working.
Wow. Good afternoon, everyone. I think we should move on and start our program. Good afternoon. My name is Jimmy Volmink, and I'm the Dean of the Faculty of Medicine and Health Sciences at Stellenbosch. It does give me great pleasure to welcome everyone to this media briefing. We are very grateful for the presence of the media here this afternoon. I've been given some names of the various media groups. So we have ETV News here, Newsroom Africa, EWN, Cape Argus, and Netwerk 24. There may be others that I don't have on the list, but please know that you are very welcome, and we look forward to this engagement with you. So, as we have indicated, this event, including the rally and this media conference, is about solidarity. Solidarity with those that are struggling in different ways in dealing with the battle against COVID-19. We're here as health professionals today to bring you some really, what we believe are really important key messages. For the past 18 months, there has been a raging battle, a war, literally. And you know, there are people who don't really believe that this war is happening because the enemy is invisible. But what we do know is that many have already lost their lives in this war. More than 84,000 South Africans have lost their lives, and almost 3 million South Africans have been sickened or have been maimed by this enemy. Fighting on the front line of this war are our colleagues, the people we know and love, and we work with and we highly respect. They are healthcare workers of different kinds. They are fighting with all their might. They are fighting valiantly. But yet, we don't have good news to give to you. We are losing the battle against this enemy. That is the reality. Our enemy is becoming smarter. It is retooling itself all the time. And it's coming at us with greater and greater ferocity. And the impact on our lives and livelihoods is devastating. Healthcare workers are exhausted. They are exhausted physically and mentally. And indeed, more than 130,000 health workers have already lost their lives in trying to protect us. We are here today, therefore, to ask for help, the help of the public, the help of the media, the help of everyone, our healthcare workers, everyone. We have at our disposal an effective weapon to overcome the enemy. It's called the COVID-19 vaccine. And we are here today to plead with all South Africans to help in the fight against the enemy by using this weapon. Healthcare workers cannot do this on their own. We need everyone's support. We need people to join hands in fighting this enemy. So today you will hear from a number of our colleagues, many of them frontline workers against COVID-19. And they will tell you in their own words and through their own experiences why it is important for us to come together as South Africans to fight this battle. There are quite a number of them that will speak, and they'll be very brief. And I will not now introduce them, but as they come up, I would ask them just to give their names and just say how they fit in to the whole picture, and then speak to you. The media briefing has been planned for about an hour. There will be some time for Q&A collectively, but also individually if the media is interested in that. So that's all I'm going to say. Thank you very, very much for being here. This is such an important event for us. And I look forward to listening to our colleagues now as they speak. And I think the first one up is Dr. Therese Fish.
So good afternoon, colleagues. I'm Therese Fish. I'm one of the 3 Vice Deans at the Faculty of Medicine and Health Sciences. My title, I'm the Vice Dean of Clinical Service and Social Impact. And so part of my responsibility is to ensure that we have a pipeline of healthcare workers for the future. And so I work with my colleagues in the public sector to ensure that we have the place, the platform where we can train our students. So as a faculty training the next generation of health professionals, it is essential that we continue to ensure a steady pipeline of new graduates. During the first, the second, and now the third wave of the pandemic, we lost many of our health professionals, and so many more were affected by becoming ill, and many have suffered a mental illness. They worked tirelessly to help save our family, our friends, our colleagues, and our neighbors. In March 2020, when the President put the country into lockdown, we had to send all our undergraduate students home. And then we had to start the debate, well, what are we going to do if we don't train healthcare professionals? And so working with our colleagues at the Department of Health and with many of the colleagues that you will hear today who are clinicians at the coal front, we had to negotiate how do we bring the students back so that we could, at the end of 2020, deliver doctors, nurses, physiotherapists, and the specialists in many, many of the disciplines that we train. And you will be pleased to know that we achieved that. We graduated over 500 students, undergraduate students who are new professionals in the health service despite the pandemic. So we were very privileged in the first quarter of 2021 that our staff and students could participate in the Sisonke trial, and I'm sure many of you know about it. And so our faculty management team under my leadership facilitated the rollout of the vaccination for staff and students. We set up a dedicated email, we have apps for everything. We had an app where our students and staff could register, and we had some staff members who assisted. So we were very proud, and one of our students will speak to it later, that today we have over 70% of our undergraduate students who are vaccinated. We're still unhappy about the other 30%, but we're going to encourage, and we hope today will also encourage those ones who are not yet certain about vaccination. So while vaccinations are not mandatory, we need to ensure that our students are not at risk from contacting COVID while in these training environments. And we know from many, many centuries and years of experience that vaccination is the way to prevent severe illness and death. Our students also train in schools and in NGOs. And it may be that in the future, these environments say to us, Dr. Fish, no, you may not send your students to train in our settings if they're not vaccinated. And so we, especially because they'll be working with vulnerable people. So we today, and we continue this as part of our DNA now, we want to encourage our staff and students first and foremost to be vaccinated. But more importantly, we want to encourage the population of South Africa to take up the plight that our healthcare workers who will speak to you today to be vaccinated. Despite having to manage the pandemic, they continue to train the next generation of healthcare professionals, and I salute you. Thank you.
Good afternoon. I'm Wolfgang Preiser. I'm a medical virologist at the university and also at the National Health Laboratory Service here in Tygerberg. I'm going to talk about the virus. This virus is going to be with us forever. There is no chance anymore that we will get rid of it again. And that means that everybody, every single person on Earth will become infected sooner or later. There's no escaping from that. And it basically means we need to learn to live with the virus. But luckily, the vaccines can help us do that. Vaccination, widespread vaccination, will allow us to enter what we call the endemic situation without too much pain and suffering. Everyone who has been vaccinated will be under a protective shield. Vaccination gives excellent protection against severe COVID-19 disease and against death, and some degree of protection from infection and from becoming infectious. So also thinking of others. Without the vaccine, everyone will become infected. That's a fact. Particularly the elderly and those with medical conditions are at high risk, but being young and otherwise healthy is no guarantee of getting just a mild disease. We have seen that to our great pain and sorrow amongst friends, family, and colleagues, that even those who do not have risk factors for severe disease may die actually from COVID. And remember, there is no escape from it. Everybody will become infected sooner or later, probably sooner. Widespread vaccination will give us a level of some protection at population level. Those who are vaccinated are largely protected, and if enough of us are immune, this will also help protect the others. Those include people at high risk of severe disease, and tragically in whom also the vaccines are less effective. So we need to help them also to get through this by lowering their risk of exposure. Eventually, in a few years from now, and I hope these will not be painful, terrible years like we've been through now, SARS-CoV-2, the virus that causes COVID-19, will become a common cold virus. We will all be infected several times over our lifetime, just as we are with those common colds and snuffles and coughs and everything else. But thanks to vaccination, these infections will just be a nuisance. The typical thing, you stay in bed, you take a Panado, you stay in bed another day, and then you're better. And they will boost our natural immunity. And that is probably the long-term scenario for COVID-19. But it's only vaccination that can now take the edge of what's happening anyway. We are moving there, whether we want it or not. And only vaccination will help us make that transition smoothly and without too much pain. So go for it and let us vaccinate our way out of this pandemic. Thank you.
Good afternoon. My name is Dr. Nishad Sharma. I'm the head of General Internal Medicine. I have been trying to lead an inpatient response at Tygerberg Hospital for patients not requiring ICU but high care and ward care. I've also been asked by the Department of Health, Western Cape, to lead the inpatient response and be the lead clinician for the province in advising them on matters related to inpatient care. But I must say, this journey has been very hard and very difficult. And I think Dr. Fish has outlined many of the challenges as we've gone along. But from a personal note, I just wanted to reflect and say, you know, at the start, we worked with great uncertainty and fear. We didn't know what we were dealing with. We lost close colleagues, and we mourned in those early days. But we overcame our fear, and we rallied around working out how we're going to save as many people as possible in this pandemic. We prayed and we tried not to lose hope during this whole episode. All the while we searched for answers, we searched for ways to save our patients, to save our colleagues. We were offered promises of salvation when the vaccines arrived. And to be honest, we were skeptical initially. I remember the intrepidation when I was offered to take the vaccine and said, should I or shouldn't I? How do we know? But we were brave. We stepped forward and we trusted the experts and the information that we've always trusted for all other disease entities that we deal with. And we took the vaccines. And then we saw firsthand, after we were all vaccinated, how we were being protected by the vaccine as healthcare workers. But now we are struggling to understand why. Patients trust us with every other healthcare issue, but refuse to trust us about vaccines and why we should use them. And we are struggling seeing patients in our wards present day after day, and every single one of them on my ward round this week was unvaccinated and could not give me a good reason why they did not take the vaccine. And that's what we are struggling with as we speak, and hence the reason for this rally, that we try and get every opportunity, every moment that we can to get the message across that we have that information. There are millions of vaccines that have been administered around the world. There are countries that are opening up their economies. There are people in stadiums watching soccer matches. We so much would like to be there. So whatever people are reading and believing on social media and all the misinformation, all I am saying is, if you trust us with your other healthcare needs, trust us about COVID-19 and the vaccination. Thank you.
Hi, good afternoon. My name is Usha Lalani, and I'm a specialist physician, and I'm an intensivist. More. Oh, this mic. Yeah. See. Okay, again, I'm a specialist physician and an intensivist. And an intensivist in probably one of the greatest times that any intensivist can be alive. This is where ICU care had to be perfect. Together with a team of doctors, nurses, respiratory techs, physios, dietitians, cleaners, and porters, we have cared for more than 1,000 patients with severe COVID pneumonia in our unit over the past year and a half. For those who don't know, patients with a severe illness are the patients that struggle to breathe on their own, the patients that need high flow, patients that need intubation, and the patients that need ventilators. So when I was asked to speak today, I must admit I was actually quite reluctant, and for me that was very strange. For those who know me, I speak a lot. And the reason why I could not understand is because I'm so strong and I feel so passionately about everybody should be vaccinated, but yet I just don't have the words to express what I feel anymore. I don't have words left to try and convince people to please vaccinate and save lives. So I decided not to tell you again that vaccines save lives, that it protects you from severe illness, from hospitalization, and from death. I've decided not to tell you that over the third wave, every single patient that was admitted to my unit, and there have been a lot, have been unvaccinated or partially vaccinated, and they have died. I think we've all seen the stats, the graphs, the research showing the benefits of vaccines, and I think they speak for themselves. But what I want to tell you was about our experience in the ICU over the past year and a half. So we in South Africa had the advantage of having about a month of preparation before we were hit by the pandemic. At that time, the social media was inundated with videos coming out from Europe and the UK, with patients in the corridors, dying, ICU beds that were filled. These hordes of trucks filled with bodies going to the cemeteries. And I remember the overwhelming sense of fear. I was petrified that we could not save more people in our country with even less resources. And what followed after that was this immense effort by everybody to try and extend our critical care services, and we did that. But although we did it in such a way that was, even to me, seemed absolutely impossible at that time, we were still so unprepared for the stark reality of this disease that we still see every single day in our ICU. Yes, we knew we were going to see death, but we were not prepared for how much death we were going to see. There were times when 9 or 10 people died per day, that our ICU felt like a factory with patients being admitted on one end and bodies leaving, covered and wrapped up on the other end. We were not prepared for the fact that no matter how much we have trained, how much experience we had, and how much knowledge we had, we could not save these people, that people died no matter what we did. Nothing prepared us for the fact that whole families were wiped out at one go. That a colleague of mine begged and pleaded that we save at least one of his parents so that he could see the new child. Nothing prepared us for those countless young women that were pregnant that died. Women who are in the prime of their life that should be preparing baby showers and buying little onesies for their children. Nothing prepared us for that 36-year-old man 2 weeks ago who told me, please, Dr. Lala, please save me. I'm getting married in 2 months' time. And nothing prepared us for that pain and suffering that we saw as the countless families stood at our gates up till today, thanking us for what we're doing, but sobbing. So these are just a few stories, and I can go on, and I only have 3 minutes. But I'm not telling you this to make you to make you feel sorry for us. That is not the reason why I'm telling you these stories. I'm telling you these stories to let you know COVID is real. It does not discriminate between anyone, whether you're young or old, rich or poor. And even though you may feel safe and protected, you are not. I remember the day the first batch of vaccines came to Tygerberg Hospital, and somebody took a photo and sent it out in a WhatsApp group. And I cannot explain the joy and the euphoria we felt. In fact, I burst out crying. And the reason why, because finally there was a light at the end of the tunnel for just not the healthcare workers, but all the people that we serve, that there was hope. Yes, we are exhausted. Yes, we are angry. Yes, we are frustrated. And yes, there are days which are getting more and more frequent that we feel we cannot do this anymore. But we will do it, because this is what we've trained for. This is whom we are. This is what we dedicate our lives to do, to help everybody, to make sure that the mother, the brother, the sister, the child that is under our care gets out of hospital and back to their lives. And as I stand here today, my plea to each and every one of you, just step back for a moment. Step back from the hype surrounding vaccines, from the numerous posts on every single social media platform there is, telling you to either vaccinate or not vaccinate. Step back from those conversations that you're having in the corridors at work or at dinner parties or whatever you're doing. Just step back and take a look. Take a look around you and see the pain and the suffering and the destruction that this disease has done. And realize that we are not the frontline fighters. You are. Realize that you have the power to put an end to this pandemic. You have the power to allow kids to grow up with both their mum and their dad. You have the power to make sure that restaurants are opening. People can go to sports events, can take their child to a rugby match or a soccer match. You have the power to save lives, not us. You have greater power. Please vaccinate. Thank you.
afternoon, everyone. My name is Tamzin Llovlock. I'm a specialist in internal medicine at Tygerberg Hospital, and I'm also the senior registrar in infectious diseases, pursuing my training in infectious diseases. Before joining the team at Tygerberg, I was the lead clinician at Brackengate COVID-19 Field Hospital. So when I was thinking of what to say today, I cast my mind back to when it all started, and March 2020, that fateful first lockdown, just 2 weeks. And it seems like so much has happened since then. 18 months, and really for these 18 months, COVID has been my life. But that's not a unique story, is it? Because the influence of COVID-19 can vary from inconvenience to extreme tragedy, but it's universal. No individual has been left unscathed by this pandemic. And really, we can say that COVID-19 truly is a common enemy. It's an enemy to us all. But we've come a long way in these last 18 months. And when reviewing my own memories, something that stands out to me as a milestone is when I received my own vaccination. And you've heard us speak about it before with my colleagues. It was such a momentous day. I was elated. It was such a joyful occasion. As a healthcare worker, I was prioritized. I felt special. I felt privileged. I received my vaccination in February, just as we were coming out of our second wave, and it felt like a lifeline. It felt like the first step towards something positive in a long, long time. I felt empowered, and I remember distinctly feeling on that day, I can't wait until this protection, this security, can be extended to my loved ones, to my patients, and really to everyone who has been fighting their own private battle with this pandemic. Something which we don't necessarily know about someone when we meet them in the street. You don't know what their battle has been. But I'll just reiterate, no one has been left unscathed. So thinking back, I was so excited for this protection to be extended to everyone. And then I realized, well, that time is now. Vaccination is available, it's safe, it's effective, and it's an essential step in turning the tide against COVID-19, against this pandemic, and in returning to a life of productivity and fulfillment, a normal life, which really is what we're all craving, isn't it? So I want to say, embrace the progress that we've made as a country, as a global community. COVID-19 has taken a lot from all of us, but it's also brought out the best in many individuals, institutions, and we've seen incredible progress in management of this pandemic. Embrace that, and don't miss out. Don't be left behind. Get vaccinated, and let's put COVID-19 and this pandemic where it belongs, which is in the past.
Good afternoon. I'm Arif Parker. I'm a specialist physician and infectious diseases specialist who has actively been involved in our COVID-19 response from way back in January 2020, from the time we started screening travelers and preparing our hospitals for this COVID-19 response. So it's been a long 21 months for me, all-consuming. Also, I was fortunate to get my vaccine in February, of this year, I also remember feeling, wondering whether, a bit skeptical because we were part of the Johnson & Johnson / Sisonke trial. But I did my research, and I'm glad that I went ahead and took my vaccination. So for me, the second wave was absolutely devastating. In addition to the patients lost, I lost colleagues, family, and friends. The third wave, however, was a bit different, almost senseless. It was even more sad and heartbreaking, as a lot of these severe infections and deaths that we saw were preventable, entirely preventable. What was striking in the third wave was that my colleagues were not dying or getting admitted, as most of us were vaccinated and had mild disease when we had COVID. Family who were vaccinated ended up getting very mild disease, and sadly, those who died had delayed their vaccinations for various reasons, their vaccination appointments. Severe COVID and death from COVID is entirely preventable by vaccination. Evidence from privileged countries who had vaccination rollouts long before we were able to have demonstrated that vaccination can do the following 4 things. It reduces transmission, it effectively prevents severe COVID and hospitalization, it effectively prevents death due to COVID, and also emerging evidence shows that the vaccination reduces episodes of long COVID, so we can prevent disability due to COVID and COVID-related lung disease. So this international evidence mirrors my experience from the third wave. In my rounds done at Tygerberg, and also some of my outreach rounds done at the Brackengate Field Hospital, I found that 99% of the patients that I saw were not vaccinated. There were a handful of patients who were vaccinated, and these patients tended to have milder disease, minimal infiltrates, and we were able to discharge those patients much quicker. So please, my advice as a frontline physician and infectious diseases specialist is for you to take the vaccine. I don't work for pharmaceutical companies, and I have nothing to gain by urging you to vaccinate, except to save lives and prevent disabilities from this devastating infection. There is robust evidence that the vaccine is entirely safe, so take it for you and take it for those around you. We have seen far too many families ravaged by this infection. Children left without parents, multiple members of the same family dying within days of each other, or as we've seen, even on the same day. Pregnant women dying within days of giving birth. All of this is now vaccine preventable. This vaccine means meals with families, joyous Christmases, Eids, Hanukkahs, and Diwalis and other religious gatherings. It means celebrating weddings and, yes, dignified funerals. It means sport matches, opening up the economy, and praying in congregation. Very recently, I had a family meal with my grandmother and some family for the first time in months. And it was wonderful knowing that if that event was going to be a super spreader event, that everyone would have mild infections. No one would die because everyone present was vaccinated. The COVID vaccine works. It is safe. It saves lives. Severe disease and death in the upcoming fourth wave is entirely preventable with this simple intervention. My message to the public is to please make the right choice in solidarity with us and choose to take the COVID vaccine, not tomorrow, not next week, not next month. Please, please, I urge you to go and vaccinate today. Thank you.
Good afternoon, all. My name is Jessica Davies. I'm a fourth-year medical student here at Stellenbosch University, and I'm the chairperson of the Tygerberg Academic Affairs Council, which is a council that works quite closely with our faculty in the administration of our programs. Over this last year, I've been working quite closely with our faculty's vaccine team to try and get the students on our campus vaccinated, and at the moment, I'm busy running a task team for student volunteers to go and assist at the vaccination center on Tygerberg Hospital. So we all know that we are fighting this battle to get our nation vaccinated. And we've been living through this pandemic since March 2020. And by now, it's become part of our daily lives. Mask wearing, social distancing, sanitizing your hands at every single doorway, all of these things have become the norm. But we've become extremely used to restrictions and curfews and bans and levels and stages. But I think we can all agree that a certain degree of COVID fatigue has begun to set in for all of us. It's not normal to have to walk around with masks every day, and it's not normal to have to close ourselves behind doors and social distance. We need to return to a world where we can go out without worrying about getting ill, or visit our friends and family without worrying about spreading disease. And the only way that we can achieve this is through herd immunity. And the fastest way that we can achieve that is through the vaccine. If you are sitting on the fence and unsure whether to get the jab or not, I urge you to speak to your GP, speak to a healthcare professional, someone who can provide you with the facts. They can provide you with the reliable information that can help to make an informed decision. Social media is currently overflowing with information, and many of it is not reliable or factual. If you're uncertain about the validity of a source of information, a healthcare professional can help verify that. Evidence-based information is what we need to use to make our decisions. And to my fellow students, we are all healthcare professionals of the future. But today we are learning our profession in the midst of a global pandemic. And this has not been easy on any of us, and we've had to make a lot of sacrifices. Let's set the example for our friends and our family, our neighbors, our brothers and our sisters, and be part of the effort to get vaccinated, not only to safeguard ourselves, but to be able to safely practice our professions as well. Let's stand together as a nation to fight this virus and march closer and closer to the day when we can finally say the COVID-19 lockdown has finally ended. Well done, South Africa. We made it.
Good afternoon, everyone. My name is Alistair Broadhurst. I am currently specializing in internal medicine at Tygerberg Hospital. I'm here with having the privilege of representing junior doctors throughout this pandemic, and I hope that I can do that privilege justice. Junior doctors have formed much of the bulwark of the hospital's clinical response to COVID. I cannot overstate the strain that COVID has put junior doctors under, and it's been distressing to watch colleagues that I respect so greatly having every version of themselves dismantled by long working hours and repetitive tragedy that far exceeds the normal limits of what a doctor is supposed to endure. The majority of patient and family interactions are done by junior doctors, and we form a treatment team with the patient and their family. Managing the workload that comes with COVID is by far the hardest thing that I've ever done in my years as a doctor, but this can never begin to compare to the far-reaching devastation that this disease has had on patients and on their families. The public are spared the details of the tragedy that COVID can inflict on patients and their families. But after 18 months of being the person to deliver the innumerable 4 a.m. phone calls to husbands, wives, mothers, fathers, and children to inform them of the loss of their loved ones, I would say that frontline healthcare workers and those patients and their families should be taken seriously when it comes to perspectives on COVID-19 and the devastation that it can cause. Our institution is a referral centre for the most severe cases of COVID. We provide very sophisticated methods of organ support for patients with severe COVID, but there is still no treatment that can adequately reverse this disease. Particularly in this third wave of infections, there has been an alarming rate of young people that have been admitted with severe COVID, in addition to those with the more traditional risk factors. Many have died, and many will never recover to their pre-infection states. The development of COVID vaccines has been a high point in modern medicine. It should be viewed as something that provides hope that life may still return to normal. Vaccines are being maligned by a small group of vocal people who are literate in neither medicine nor science. There's an overwhelming amount of evidence that is freely available and is added to daily, showing that vaccines are safe and effective. I'm yet to encounter any robust scientific argument against vaccination. The only counters I've heard against large-scale vaccination have been baseless, flimsy opinions that make a mockery of modern medicine and those that have died before they had the chance to be vaccinated. We need to find every reason to arrest this disease as opposed to finding excuses. We all construct our opinions from the information that we receive. For ourselves and for society, it has never been more important to ask ourselves, whose opinion are we taking on as our own? I would ask everyone to trust the medical staff that have been working face-to-face with severe COVID since the beginning. COVID has shattered too many families, and this has to stop. We owe it to our families, our society, and ourselves to get vaccinated. Thank you.
Good afternoon, everybody. My name is Kerry Lowe. I'm a psychiatrist, and my team has been involved in caring for the mental health of people admitted with COVID-19, but we've also been involved in connecting patients and families when patients are admitted and giving updates and with staff support. So when something like COVID happens, you think this won't happen to me. It won't happen to my family. And then you start coming to work and you start seeing young people who are sick. Now, my husband is thin and healthy and doesn't have comorbidities, so of course this won't happen to him. But you come in and you see people without comorbidities who are sick. You see people who were well before who are sick. And then you see those people start to die. And then your friends start getting sick, and your family starts getting sick, and your colleagues start getting sick, and people you know start dying. I was in ICU one day when a colleague lost her mother and her husband on the same day. And it horrifies me to say this, but my first thought is, thank God this isn't me. And one of the things we do is we connect families on WhatsApp video calls. And, often the WhatsApp picture is the patient, but when they were healthy and they're doing something fun, maybe they're at the waterfront with their family smiling. And I look at that photo and I look at the person in the bed and I can't imagine that this is the same person. And I know that at some point this person also thought this is not going to happen to me, but it does. So the day my husband got vaccinated, I also cried because I'm so glad that he is now protected. He's not going to die alone in an ICU where I can't be with him. Because for me, that is my biggest fear, is not being there with him. And I feel so grateful to the vaccination and the fact that it opened up to his age group and the fact that he is protected. And COVID has taken so much from everybody. And there is so much that is out of our controls. And I think this is incredible that this is something that is in your control. So I really ask that people start taking something back and get vaccinated. Thank you.
Good afternoon. I'm Kimberley Moodley. I'm a family physician and bioethicist. The pandemic has taught us many lessons, and we've just heard many stories of suffering, pain, and death from health workers who have served on the front lines for the past 18 months. One of the most powerful lessons from an ethics perspective is our ability and our duty to care for others. For many years in South Africa now, we've been speaking about all the individual rights that we may enjoy. Our Constitution tells us that we have 27 rights that we may claim. The right to life, the right to a safe working environment, the right to bodily integrity, the right to religious freedom. And various people have been using these rights in different ways to argue for or against vaccines. And I'm sure you've witnessed all of these discussions and these debates. The one thing the Constitution does not tell us is that we have a right to deliberately infect others or that we have a right to kill others. And by failing to vaccinate, this is what we risk doing to our fellow human beings. With rights come responsibilities. We have many responsibilities to each other, to our families, our friends, our patients, our colleagues. Most importantly, to all the healthcare workers that have been fighting tirelessly to save all of us. And so we need to think very carefully about how we can ensure that we fulfill those responsibilities. Umuntu ngamuntu ngabantu. A person is a person through other people, and there is no greater time to remember that than now. This pandemic is about the common good, is about us learning to take care of others and to protect others. And vaccinations give us the ability to take up that responsibility and to ensure that we can all get this pandemic under control, that we can restart our economy, prevent a fourth wave, and ensure a better life for all. Thank you.
Good afternoon, colleagues, ladies and gentlemen. My name is Nico Gey van Pittius. I'm the Vice Dean for Research and Internationalization of the Faculty of Medicine and Health Sciences of Stellenbosch University. Thank you for joining us this afternoon on this very important event, and thank you for the colleagues for sharing their experiences and their perspectives this afternoon on the importance of vaccination and the effect that it has had on the healthcare workers and our colleagues over the last couple of months. So as the Vice Dean of Research and a Professor in Molecular Biology with more than 20 years of experience in laboratory-based research on infectious diseases, I can confirm that the best available evidence at this stage tells us that the COVID vaccines are the most effective tool and in fact the only tool that we currently have to prevent severe disease, hospitalization and death for COVID disease. So we are now going to go over to the questions and answer session for 15 minutes before we wrap up. So you are welcome now to please indicate whether there are any questions from your side to any of the panelists. And we have one or two people around with microphones that will be able to allow you to ask the questions. Thank you.
Thanks for that, Prof. Firstly, I just want to say thanks to everyone who's obviously spoken today. This is perhaps the first time that we've heard from medical professionals exactly what they have been experiencing. And as members of the media, it's been a little difficult to get a full sense of what's happening in the ICUs, for example, with access and so on being quite constrained over this last time. I have a question perhaps for Prof. Moodley around making vaccinations mandatory. Is that something that can be done, a conversation that can be had and actually followed through on in practice? And then in terms of denying treatment, are you, as, I know I guess it goes against the grain of what you're trained to do as healthcare workers, but are you allowed to turn a patient away who hasn't been vaccinated?
Okay. So thank you for those very difficult questions. But it's my job to try to answer them. So I have written about mandatory vaccines and the way... Do you want me to show? So, why mandatory vaccines? I think we are quite clear that we've had now 3 successive waves of infection. With each wave, more and more people are dying. Our economy has been closed and has suffered severely. The health of all people has been impacted. And I mean here people with COVID and non-COVID disease alike. And so we have an urgent need to improve vaccination rollout in South Africa. Now, you will have noticed that for each time we open up vaccinations to a new age group, we have an initial surge of vaccines occurring, and the vaccination sites, all 3,000 of them around the country, are full. But it takes only a few weeks for those numbers to drop. And if we continue at that rate, we will never be able to vaccinate a sufficient number of people to bring the pandemic under control. And this is why we need something that will work, that will be effective, and unfortunately, a mandatory approach to vaccines is necessary. Now, I'm not arguing for vaccine mandates for everybody, but I am arguing for mandates in high-risk environments, such as hospitals and other healthcare environments, in health sciences faculties, where there is a high level of risk, but also in all communal spaces. Because as you know, personal privilege ends where public peril begins. And as soon as we start to interact with other people, we need to ensure that we are safe and that they are safe. It has also been shown that mandatory vaccination increases vaccine uptake by around 18 percentage points. On the other hand, incentives increase vaccine uptake by between 3 and 5 percentage points. So in order to get a full impact in terms of increasing vaccination, I argue strongly for vaccine mandates in the environments that I've discussed. To move to your second question, we as the health profession tend never to deny treatment to patients. We treat prisoners, people who abuse alcohol, drugs, people who smoke. The difference in the pandemic is this. People are, in some cases, deliberately refusing to take vaccinations and subsequently placing others at risk. So this time around in the pandemic, we've noted that some healthcare professionals are taking a stand against this. Doctors in some parts of the world are offering telehealth medicine services to those who refuse to be vaccinated. And they do this to protect themselves, their staff, and other patients in their practices. Other doctors have refused outright to treat patients who are not vaccinated. And we have a concept called conscientious objection in medicine. Now, typically, it has applied to termination of pregnancy or euthanasia or that type of ethical conflict. We've never really examined conscientious objection in the context of a pandemic such as this, where there is deliberate spread of infection by people making very specific choices. So yes, this is a new phenomenon. We're all not very clear about it as yet, and it will need to be challenged by the Health Professions Council and in the courts. And there are very good arguments to be made on both sides of this debate. You've heard from many of our healthcare workers today. They are exhausted physically, emotionally, and mentally. There is compassion fatigue setting in, and that is a huge threat to human health services. When our very own healthcare workers are becoming so fatigued that they are finding it difficult to uphold their usual duties towards patients. I hope I've answered your questions. Thank you.
Thank you, Prof. Moodley. Colleagues, ladies and gentlemen, other questions? Thank you.
Hi, I'm Nadine from ENCA and ENES. I first want to ask if there is a possibility of anyone answering something in Afrikaans.
Absolutely, I think so. Yeah.
Okay. My Afrikaanse vraag gaan oor ivermectin. Dit is van namens ons kykers wat ek hierdie vraag moet vra. En ek wil weet of daar enige mense is wat julle behandel het wat minder ernstige simptome gelei het, of daar enige bewyse was wat julle maar net gesien het van ivermectin wat wel help om die virus te beveg, of is dit so dat die mense wat nie ingeënt is nie, meestal die mense is wat ivermectin gebruik het? Ek sal net graag wil weet wat julle sien.
Ek gaan vir professor Reuter vra om hierdie te beantwoord. Asseblief, hy is die uitvoerende hoof van geneeskunde.
Okay, ek is Helmut Reuter, hoof van interne geneeskunde. En ek is vandag hier omdat my vriend en collega Jantjie Taljat nie hier kan wees nie, want hy is siek met COVID in die bed met sy vrou. Ek sal graag die vraag beantwoord oor ivermectin. Ons het geen bewyse dat ivermectin enige positiewe effekte het om COVID-siekte te voorkom, om die transmissie daarvan te voorkom, om die siekte minder ernstig te maak of om sterftes te vermy. In teenstelling met die vaksin wat al van die doen, soos die my collega's genoem is. I'd just like to repeat that in English. The question about ivermectin is that there is no scientific evidence, there is no pharmaceutical evidence, there's no clinical evidence that ivermectin has any effect on the outcomes of SARS-CoV-2 infection or COVID-19 disease. It doesn't prevent the disease, it doesn't reduce the transmission of the disease, it does not cause any better outcomes, and it does not prevent death. So in our institution, we've not used ivermectin, and we do not think there is currently a place to use ivermectin, especially not formulae that were designed and tested in animals and not in humans. Ek sal dit weer in Afrikaans ook noem. Ons sal by hierdie institusie gaan ons nie ivermectin gebruik vir enige mense nie. Ons gaan dit veral nie gebruik in enige formule wat vir diere getoets en ontwikkel is nie, want ons is bang vir middels wat nie getoets is nie. Ons glo in middels wat getoets is en ons glo in wetenskap. Thank you.
Is it on? Oh, sorry. Just to clarify the last bit of my question.
Yes.
Have you seen that unvaccinated people, have they mentioned that they've been using, is there a correlation between people not getting vaccinated and using ivermectin?
Yes, there seems to be a correlation. I've not done a study on it, but there definitely seems to be a linkage between people who do not promote the vaccine and who promote ivermectin, and patients, individuals who have stocked up on ivermectin or have used it but have not been vaccinated. So it's a very clear clash with science and with the advice that your doctor would give you. There are doctors who do give bad advice. There are doctors who have prescribed ivermectin, and it's a problem that we need to tackle head on. Thank you.
Maybe just to add to that, I think internationally there's been a huge rise in poison, calls from poison information centers, etc., in terms of ivermectin use. So that's another issue that needs to be taken into account, especially since people are using ivermectin that's not formulated for humans. Okay, any other question? Yes, sir.
My name is Kim and I'm from Eyewitness News. My question is for Dr. Sharma or Dr. Lala, and that is with regard to people being treated following vaccination who've developed an adverse reaction. Have you seen patients or treated patients? Because outside there's a bit of a notion, or people feel that us as the media, together with the healthcare workers, are underplaying the so-called side effects as a result of vaccination. So have you seen any patients post-vaccination?
Okay, so I'm going to answer on behalf of Dr. Schroeder. The vaccine is entirely safe. In our rollout, we've had very few patients who had side effects. The majority of the side effects that we see are mild. Okay, so a sore arm, mild flu-like symptoms, within 3 days it's over. We've seen some fainting or vasovagal episodes, and mostly with the new age gap being opened, so fear of needles, etc. But overall, we've had no admissions for vaccine-related adverse effects. We have had admissions of patients who had COVID or developed COVID, and where we think the exposure was before vaccination and not really related to the vaccine. Naturally, I mean, we're vaccinating a global population and people die, so people will die of the vaccination, after vaccination. And thus far, in all the cases that I've seen or been involved with, I have seen no relationship between vaccination and death. So patients naturally died of other causes that were unrelated to the vaccine, and these are very few and far between. So the vaccination is entirely safe. I just wanted to add to what Prof. Reuter said on the ivermectin question. So as you know, global literature shows that ivermectin is not effective. Drug trials or studies had to be withdrawn because the studies were unethical, and most notably the Egyptian study. And that had knock-on effects on other studies. So my experience from working in the wards and Brackengate is, which is our field hospital, is that we had many patients who were taking ivermectin on the side, and it was actually not making a difference. All right, so these were patients who were not vaccinated but taking ivermectin. And I think all that ivermectin gives is false hope. It doesn't work. Thank you.
So just to say something about the ICU patients and the vaccine. So as we all know, severe anaphylaxis has been reported as one of the possible complications of vaccines. But if you actually go back to the literature and look at the percentage of people developing severe anaphylaxis, it is so tiny that it, in a population with so many billion people, the benefit of vaccinating is much greater than the risk of the anaphylaxis. From a personal perspective, we have not seen a single patient in our ICU with vaccine-related complications at all. I just want to also give my very firm and personal opinion about ivermectin from an ICU point of view. So as Prof. Reuter had said, it doesn't show any benefit in terms of hospitalizations, severe illness, or death. From a personal perspective and my communication with other ICU colleagues throughout the country, it has actually shown to be maybe harmful. And the reason why is because it's not tested in humans. The dose is not decided on. So what is happening in these patients who are taking ivermectin, not only do they present late to the hospital, where there's very little that we can do at that stage, but it masks all the signs and features that we look for as doctors to say this patient is sick. So my plea again, ivermectin is not the way to go. Please vaccinate.
So I just want to add to part of the question. I suspect you are asking about people who reports of people who received the vaccine and then got sick or were admitted or died. Now, Professor Shabir Mahdi has already indicated in the work that has been done around vaccination that up to 20% of people present for their follow-up vaccine already infected with COVID at the time that they are vaccinated, and then present with COVID infection shortly afterwards. Okay, and that's what we have been seeing, where people they do not have the full protection of the vaccine as yet, and get COVID, and then present to us. Fortunately, the majority of those patients survive and go home. And when I say majority, I'm talking in excess of 95%. But there have been incidents. I mean, just sitting there, I received a media query about someone who was vaccinated and died. We haven't investigated it yet and looked into the case, but the majority of the cases that we've looked into, there was it looks as though the person was infected just before they got their vaccine, and they also then had a delay in presentation to hospital. In other words, they were sick at home, very hypoxic, very dehydrated, then came into hospital and were in dire straits already. So I just wanted to make that clear. Taking your vaccine doesn't mean you take off your mask and live. You have to wait for the protection to kick in several weeks later. We still have to protect ourselves.
Yeah, and just in terms of the anaphylaxis, it's normally very rapidly after the vaccination, so not days and weeks later. There's a question.
I have a question for Dr. Fish around what some of the reasons are why some students on campus and perhaps some healthcare workers too haven't yet been vaccinated. And what are some of the campaigns to convince them to get in line and offer their arm?
So I think that is the million-dollar question. Why are people vaccine hesitant? And I think the reasons, and I'm going to ask we brought our students along because they asked the students why they don't get vaccinated. So I'm going to ask Jess to come in and speak to the survey that they've done. And certainly from our experience, and we don't have any evidence for it because it's anecdotal, that people are fearful. There are people that are worried that the vaccine, how did we make the vaccine? The vaccine was developed in a few months, and some of the colleagues, the professionals will tell us how long we've been developing vaccines. This is not a new type of vaccine that we've developed. So there is a lot of fear. And we have our nursing staff, we have doctors who are fearful. So I'm going to ask some of my colleagues if they've got any other ideas around why people are not taking vaccines. We know the evidence is there for vaccination. I think there's a lot of fear. We know there's some people who have religious reasons why and we've seen some of our judges who have made utterances about vaccinations. And so I think it's difficult for us to answer. I think you've got to ask the people who are not taking the vaccinations, and that's why I'm going to ask Jess to actually speak to the survey that they've done amongst our undergraduate students.
Thank you, Doctor. Just before Jess steps in, when you hear colleagues in the profession speak with that anti-vaxxing voice, how does that make you feel?
Is this off the record or on the record?
We can take it off the record, no problem.
Let me say I'm disappointed. I would like to say I'm mad as hell, but I will just say I'm disappointed. Because part of what we do, what you've heard my colleagues, we and this university has got a very, very strong basis of practicing evidence-based healthcare. And if we have not convinced our students, our staff, especially our health professions, around the evidence, then we feel that we have failed. And so it does disappoint me, and it will continue to disappoint me and many of my colleagues around the table. And you've heard the plea from the colleagues, let's vaccinate the nation. And as Professor Moodley also told us in some other correspondence, let's vaccinate before the elections, because we certainly don't want to have the elections as our next super spreader, or people not coming for election because they are not vaccinated. So I'm supporting Professor Moodley on the let's vaccinate the nation as soon as possible. But let Jess speak to some of the reasons why people are not getting, the students anyway.
Thank you, Doctor. Thank you very much.
Yeah, so this is a question that is very difficult to answer because I also really don't understand why. We've been working very hard to try and get everyone vaccinated on our campus and done multiple posters and campaigns. We had tables set up to help people register in their lunch hour and whatnot. But there's still this group that is just not getting vaccinated. So we ran a survey with the entire campus to try to figure out what could possibly be the reason that they are choosing not to register and not go for their vaccination. Some of the responses were quite interesting, and what I saw more than once was actually their parents are telling them they forbid them from doing that, which was quite interesting to read. So that did come up more than once. It wasn't the most obvious. It wasn't the most obvious answer, but that was, and a lot of it is also just people were afraid that because the clinical trials, it didn't take as long to develop the vaccines. That was a big concern at the beginning. I would say, like during Sasonke, that was the biggest concern, that this vaccine is, it hasn't gone through the same robust trials, and so people are scared that this is not going, it's going to have long-term side effects and stuff that you won't see now, and it might come up later. So we had information sessions trying to, explain the vaccine and explain how they did the trials and everything. And recently, at this point now, with Pfizer and that being an option for students, at this point, I don't know. I really don't know. I don't know what the problem is, but we are still trying. Constantly sending reminders, but yeah, I think the hesitancy is probably the same reason maybe the rest of the population, those who are hesitant, is probably the same reason.
Thank you, Grace.
Yeah, so the two other words I think is frustrated and flabbergasted and angry. Those three words. I'm sure my colleagues can add to that. Disappointed, I think that was mentioned, but angry, frustrated, flabbergasted, because we don't understand why. Yeah, colleagues, ladies, gentlemen, I think we need to wrap up. Unfortunately, I think we can carry on for quite a while. There would be an opportunity if there's a need for that and if the panelists are available to have individual discussions with them afterwards. I'm not sure of the availability of everyone, but you're welcome to request that. So thank you once again for joining us for this very important event. I think you saw the passion in our colleagues. This is a small group of colleagues from the faculty, but this is supported by most, if not all, of the colleagues in Faculty of Medicine and Health Sciences. We all feel very strongly about this, and I just want to read to you, and you've probably received this as part of our solidarity statement, but a poem that was written by one of the frontline clinicians. In the first wave, you applauded us. In the second wave, you sympathized with us. In the third wave, you ignored us. In the fourth wave, we gave up. We fought a disease half the world doesn't believe in. We fought the despair of watching you slowly die, powerless to intervene. We fought the waves of disinformation, the ignorance and the arrogance. We fought for you. We fought for our families. We fought for us. We don't have much fight left in us. We are exhausted and we need your help. Get vaccinated and prevent the fourth wave. So this is how we feel at this moment. I think our healthcare workers have brought us here. We are now at a stage where we have to pass the baton to the public and say, please help us with this. We can't do this on our own anymore, and we really need your help. So I would like to thank everyone for coming this afternoon. Thanks for the colleagues who made time available, and you know that we are still busy with the third wave. These colleagues are very busy, but they feel so passionate about this that they actually took time to come and spend really a long hour with you. Thanks for the initiator of the event, Professor Soraya Sidat, who's been very quiet, executive head of psychiatry. Thank you to the Dean, Prof. Wolfgang, for his opening words and also for supporting this initiative, the colleagues of the faculty, colleagues of marketing and communications who've organized the event, Mr. Menwen Sambu and the colleagues for the technical support. We know that something like this doesn't happen overnight, so thank you very much for all the hard work you've done. We have the scientific tools, proven tools to prevent this pandemic from going further. Please make use of it. Please help us as the media to spread the word, to allow our people to not suffer any further. Thank you very much. Drive safely and have a good afternoon. Thank you.